Please can I have confirmation? Thank you. Please can I have confirmation that the live stream has started?
Yes, Chair, we're live.
Thank you very much. I will go to each board member present in turn to confirm that they can hear and be heard. This is a legal requirement for virtual meetings. Where practicable, please also have your video switched on so that you can be seen by those in attendance and the public watching. I'll begin with the board members. So today we have Claire Scott, who is from NHS England.
I can confirm.
Thank you. Chris Baird.
Can confirm, Chair.
Right. Hazel Braund.
Good afternoon, Chair.
Thank you. Chris Burden.
Councillor Crockett, I'm here for the Health and Care Trust, so I am deputising for Chris Burden today, and yes, I can hear you, and good afternoon, everybody.
Thank you, Sue. Dr. Mike Hearn.
Yeah, hi there, Councillor Crockett.
To Councillor David Hitchener.
Yeah, good afternoon.
Rebecca Howell-Jones. I didn't hear you, Rebecca.
Sorry, can you not hear me?
You're very quiet. But... Okay. Jane Ives.
Yeah, good afternoon.
Good afternoon. Felicity Norman, councillor.
Yes, hello everyone. I can hear.
Ivan Powell. Is Ivan with us? No. Ian Stead.
Yes, Ian here.
Thank you. Superintendent Sue Thomas. No. Professor Tamar Thompson.
Yes, good afternoon, Chair. I'm here on behalf of Dr. Ian Tate.
Thank you very much. Nathan Travis. No. Councillor Ange Tyler. Stephen Vickers.
Yes, Chair, I can see and hear you.
Thank you. I'd also like to request any councillors in attendance to confirm that they can hear and be heard. And today we have Councillor Yolandi Watson.
Thank you, Chair. Yes, I can hear you and see you, and I apologise for my camera being off, but I have very unstable internet since lunchtime. Thank you.
Okay, thank you very much. We also have a number of officers attending, and I will ask each officer to introduce themselves when they're invited to speak during the meeting. Thank you. So welcome to the meeting of the Health and Wellbeing Board, being held today, Monday, the 8th of March, 2021. It's a beautiful day out there apparently today, so I appreciate all your time and energy on this afternoon's meeting. The agenda papers and other relevant information for this meeting are available on the public viewing public viewing on the Herefordshire Council website. The council is streaming this meeting live on Herefordshire Council YouTube and is making an official recording. To ensure that the recording quality is maintained, please speak as clearly as possible and keep background noise to a minimum. Microphones should be muted when you're not speaking. If any attendee loses connection and it is not possible to recover the connection within a reasonable amount of time, the meeting will continue as long as the quorum of board members remains able to hear the proceedings and be heard. When you wish to speak, please use the raise hand button, which, depending on the Zoom version you're using, is found either against the name in the participants list or via the reactions icon at the bottom of your screen. I'll then invite you to speak in order of the hands being raised. Voting will be undertaken electronically using the voting software within the virtual meeting platform. Only board members may vote. At the appropriate time, non-voting attendees will be moved into a breakout room temporarily until all eligible votes have been cast. In the event that electronic voting is not possible to use or there is a technical failure, I'll ask each board member by means of a roll call to indicate if they are for, against, or abstaining. The results of the roll call will only be recorded in the minutes where there is a requirement to do so. So moving on, item 1 on the agenda. Today we have apologies for absence. Are there any apologies being notified to the clerk?
Yes, Chair, thank you. The apologies have been received from board members Hayley Allison and Julie Grant of NHS England and NHS Improvement, Richard Ball of Herefordshire Council, and Dr. Ian Tate of Herefordshire and Worcestershire Clinical Commissioning Group. As we've heard, I think Chris Burden from NHS Herefordshire and Worcestershire Health and Care Trust will also note his apologies in that case. Also draw attention in the agenda, we reference Joanne Olner being a representative of the CCG, but she's to be replaced by Simon Trickett going forward. However, Mr. Trickett cannot make this particular meeting, hence we've got Hazel Braund attending.
Thank you very much. So item 2 on the agenda, it's named substitutes, and you've just mentioned those named substitutes. Are there any others?
Yes, indeed. So we have Roger Allenby's attending for Richard Ball from Herefordshire Council. We have Professor Tamar Thompson substituting for Dr. Tate, as we heard. Hazel Braun for Simon Trickett, as I said. Sue Harris for Chris Bird, and then and also we have Claire Scott attending as a non-voting representative on behalf of NHS England and NHSI. Thank you.
Thank you. Gosh, it gets more complicated as the time goes on, doesn't it? Item 3 on the agenda, declarations of interest. Do board members wish to declare any interest in the agenda item? No. No. Okay, so item 4 is the minutes. So the minutes of the meeting held on the 7th of December 2020 are included in the agenda on pages 9 to 12 for approval. No matters of accuracy have been notified to the monitoring officer, so I'll ask board members to confirm that they agree the minutes by an electronic vote. Please can non-voting attendees be moved to a breakout room for a few moments during the vote and the number of voting members be confirmed.
Chair, we have 13 voting members and they may vote now.
Thank you. And you've brought up the voting screen. Board members, please cast your vote either for, against, or abstain. Please ensure you press the submit after selecting the option which you're voting. Have all voting members voted?
Yes, Chair. Yep, all votes are in and those have been approved unanimously.
Thank you very much. Can you return all non-voting attendees now, please? Thank you everyone for being patient. Those minutes were approved unanimously. So we'll move on now to item 5, which is questions from members of the public. Members of the public have the opportunity to submit questions in writing to the board ahead of the meeting. On this occasion, no questions have been received from members of the public. Likewise, we'll move on to item 6. Councillors' questions. On this occasion, no questions have been received from councillors. So without further ado, we'll move on to item 7, which is the main body of this meeting today, which is the Director of Public Health Annual Report. The purpose of this item is to receive the 2020 Director of Public Health report to seek the support of the board in implementing the recommendation. Can I now invite Rebecca Howell-Jones, Acting Director of Public Health, to introduce the report, please.
Thank you, Councillor Crockett. Thank you. Yes, thanks for sharing the slides. We've got a few slides. I'll just whiz through to give some of the key highlights of the report and sort of emphasise what the request is today. There's a lot of colleagues on the line as well who may wish to obviously contribute a bit more detail about some of the aspects and some of the response in particular, where there's been some great work and some great working across the system. So obviously the DPH report is a statutory requirement to do. topic can be chosen from year to year, and I think it's was only going to be one topic in a sense this year. So if I'll just briefly go through the DPH report then. Sorry. Oh, thank you. Sorry, I was trying to press the down button, forgetting that I'm not in control. So I shall ask you, thank you for the slide. So I'm not going to dwell on this, but in terms of the, just to outline where we were in terms of what's happened over the last year, it has been a full year now. So we know that kind of at least 3% of our population has tested positive over the time, over the year. The true percentage obviously would be much higher. We know in that first wave that people weren't being tested unless they were in hospital and seriously ill. Generally, we've seen that we've followed the same pattern that's been seen generally across the country, quite often with a little bit of a lag behind. So our cases will have started rising a little bit later, and we've also found that we've come down to lower levels in between those various waves and peaks. In some senses, that's obviously, you know, we'll all have that period of our infamous period in tier 1 where we were changing restrictions, very much an island, which will have had ongoing consequences on our rates, I'm sure. And we'll see also, you know, the nuances of our environment at our peak in July that wasn't seen across the country, which reflected one large outbreak. And the second, so the top figure on the right shows the cases, the bottom figure shows the deaths in different locations. And we can see again that this follows that, you know, that wave in May last year, and then more recently this year, with that shift from location of death very much in care homes, predominantly in the first wave, and much more moving to hospital in the second wave. So that's just a very, very overview of the pattern at the top level figures that we've seen. But what I want to talk about today is more about who's been affected and what's the likely ongoing consequences. So if we have the next slide, that would be really helpful. Thank you. So obviously the impacts of COVID are been very, you know, we have both those short-term and the long-term impacts, and there'll be the effect of the virus itself. So we've had those people that have had, you know, been infected, either severe disease. Very sadly, we've obviously had deaths, and there'll be people that have ongoing consequences through long COVID. But then there's also the effects of the control measures. So both the all of the lockdown and the economic and the social impact on people. So obviously businesses have been affected. There's been physical and mental well-being impacts of periods of isolation, either as part of a case, a contact, or as part of a national lockdown, changes that we're aware of, obviously, in healthcare seeking behaviours, and obviously huge impacts on children's education. So we'll just look at in detail a few more of those. Next slide, please. Right, so this is not going to go through, but I think this is helpful just in terms of trying to articulate some of those wider impacts on the health and well-being, and how they might sort of in the future contribute to some of the morbidity and mortality that we're likely to see in the county. So the left-hand side of this figure, which is taken from the BMJ, you can see that there's that COVID, the direct impact of COVID infection. But actually then when we go to the right, we'll see that there's, you know, the impact of the home isolation, the impact of the restrictions on the economy, transport, and closure of education facilities. And I won't go through all the details, but it's there in the report, and you can see it here in terms of the different parts and the impact. And I think the ask today really, and the discussion that would be really great to have, is that actually for every part of the sector and the system to be looking both at the direct impact of the virus itself, but then actually also on all of that social and economic impact going forward, and what each of us can do in our different parts to have to mitigate the risks. And the impacts of some of it, you know, so even the education part, if you might have nothing to do with education, but there'll still be something you can do in terms of the offers and the access to sport and experience, for example, that might be something you can do to really mitigate against the impacts that have been felt by young people. So next slide, please. So this is just the who's been affected by it. So in sort of very, very top top level numbers. So we've had our sort of clinically extremely vulnerable group that have been impacted by very sort of draconian, not draconian, a very severe request to, and asked to stay at home and isolate for extended periods of time without going, even to the shops and so on, to protect themselves. And then the clinically vulnerable, a 1 in 3 residents, again, asked to undertake extra measures. In terms of the impact of the disease, the elderly have been hugely affected. The majority of deaths have been, or nearly all deaths have been in those over 65-year-olds. Care homes have been hugely impacted, both in terms of managing outbreaks and situations, but also in the terms of the deaths of residents. And obviously that has an impact both on the on the staff as well as the residents. Very difficult situations to deal with. We have a large, in Herefordshire, we have a large number of employees that work in the residential and healthcare setting, and obviously those groups are at high risk both of infection. Nationally, we're seeing that obviously the virus has disproportionately affected people in the BAME groups and also deprived populations. In terms of that data in Herefordshire, our numbers are quite small, and it's difficult to be able to sort of determine patterns, but there's no reason to think that we wouldn't have the same impact. And next slide, please. So economically and financially, we know that the business setup in Herefordshire is a lot of small businesses, which are potentially more vulnerable to the impacts on the economy, and lots of employees that are lots of workers who are self-employed. So 17% of our workers are self-employed versus 10% nationally. So there's some of the sort of structure around Herefordshire's economy that might have led to sort of different impacts that might have been seen in other areas. And obviously we have a seasonal workforce that would be impacted both by restrictions around COVID, but also anything future in the Brexit. So we know that lots of people have been claiming furlough and unemployment benefits, and that we probably don't yet know the sort of full extent of some of that impact. And obviously food and fuel poverty will have been increased during the time. We know that free school meals, the number of pupils eligible for free school meals has increased during the year. Next slide, please. This really is a fly through of the wider impacts. So there's health inequalities in terms of the health and social impact. So we know that some people have been more affected obviously in the deprived area, but also those links across to obesity, smoking, alcohol harm. And obviously mental well-being is a major issue. Mind have declared coronavirus a mental health emergency. It's the impact both of the actual periods of lockdown as well, but then also the sort of impact that we know that goes on around the consequence around the economic, the consequence of the economic impact on mental health as well. You can read the details. I'll go on to the next slide, sorry. And we talked about this, I mentioned this very briefly in terms of free school meals, but we have to acknowledge that our children and young people have missed out on half a year of face-to-face academic education. And there's likely to be a sort of increase in the existing gap between the least and the most deprived young people. Whilst we know that in Herefordshire, when children went back between lockdowns, that actually the attendance was really good. That's been an issue in other areas, and we know that's had a lockdown and coronavirus have an impact on children and young people's mental health as well. With sorry, my pictures are over the wrong side. Nearly almost half of children surveyed feeling that their overall mental health had got worse since the beginning of the outbreak. Next slide, please. We don't know in terms of the environment, the impact. To be honest, I think this probably is still to come out. So we know that there's been an impact in terms of when lockdowns have happened, that journeys have obviously reduced. But then on the other balance is the reduction in the use of public transport and the increase in the use of single cars. And then also the consequence of the cost of things like PPE. yeah, other aspects. So I think in terms of environment, we've seen that has been a change in vehicle usage, and how much that will continue. We wait to be seen. Next slide, please. So in terms of Herefordshire's response across the system, so this is a very summary slide. There's a bit more detail in the report. So there's been a real focus really on resilience and community spirit. So I think it's fair to say that the cases of outbreaks have been kept relatively low, and a lot of that is due to the direct impact of everybody playing their part and really adhering to the restrictions in place. And doing all they can to keep the virus in cases low. Across the system, we've had obviously the sort of public health, environmental health advice and support for cases and minimising risk. There's been a huge amount of really good cross-sector working around care homes, support around PPE, really enhanced support when to keep the sector really engaged. I think the sector has worked really well. There's been some of the people that have been, had really difficult situations to deal with and have done so admirably, and the real good support across from council and healthcare colleagues as well. It's been a great community response. So Talk Community, ensuring those that most vulnerable could isolate, so support around food and medication. And I'll come on to in a minute, but and that real community spirit and volunteering increase that's happened. Project Brave has been a great success with support for homeless and rough sleepers, and I think that's part of that sort of housing first approach. It's really kind of shown dividends, hasn't it, in some of the impact for these people and the huge impact on their lives. And obviously been a lot of work around sort of grants to small businesses and community groups and others to enable people to support each other as we go through, and similarly with education and childcare supporting through the students through the pandemic. This brings us on to the community with countless examples of individual and organisation contributing. Just some examples given there in terms of the laptops to kids, 7 freewheelers, Great British Forlorus. Next slide, please. And brings us to some of the positive changes, or the positives that we can take from the pandemic. So although it has been an incredibly difficult and challenging time, but I think it's also very important to reflect upon the fact that it's really helped us to, well, as a county, to build upon positive assets, works and the support. And you'll see on the right hand side the sort of figures from Talk Community.
Rebecca, you're cutting out a bit, so can you hear me?
Sorry, I can hear you. Yes, my screen disappeared. Can you hear me now?
Yeah.
Fab. Sorry, I was just going to move on to talk about the Talk Community box on the right-hand side, which really shows in figures some of the huge impact here. So, the 1,500 people registering to volunteer, I think is is fantastic. It's one of those sort of examples of the real community spirit and the community resilience that's been in place. The expedited use of digital technology, I think both I think we'll all recognise, personally in our working lives, but then also across the county, advances and changes that perhaps would have taken years to implement in normal service happen very quickly. Lots of people working from home, working, remotely extremely well. And then I think the final positive, well, not final positive, but another positive is sort of new partnerships and new ways of working that have really come to light and life in this time. Move on to the next one, please. So this is just really to summarise what the request is from the if you like, the output of the DPH report, and it is to, as we move to kind of living, we will be living with COVID for the foreseeable future, is to kind of try and address some of the sort of impacts of the coronavirus, which have both exacerbated the existing inequalities and created other challenges, to live as a healthy and happy county. And this will take all of us. It will take us in our sort of individual and family and community lives, as well as in our sort of professional and organisations. And it's to really try and gain, I suppose, and to take that overview and that sort of breadth of view from across the impacts of COVID to see how we can address those. Sorry, so final slide, please. Thank you. So it is to look at that kind of from our various organisations and various angles, to look at the sort of, as we would do, I know, but the health and social care, and address the care that's taken place and the additional needs from the virus and the impact of it, to become a healthier county, to sort of to have the habits and the environment that we can support people both physically and mentally to keep well. Plans that address and rectify some of the inequalities that have been created through lockdown and over the last year. And an economic recovery that ensures that those employment and business opportunities for Herefordshire residents, and that sort of facilitating those people that, recognising, for example, that children and young people may not have had opportunities over the last, or will not have had opportunities over the last year that may have had previously, businesses would need to recover and so on. And then also to look at the environmental impact and how we can support that going forward to have as green a recovery as possible. So it's a very flying overview. There's a bit more data in the report. With apologies, you've got a non-design version in the thing, and we will make it a design version with some more pretty infographics and so on for people to be able to get some of those figures right across. And if I may, I think there are big colleagues on the line who might wish to mention some of the sort of more detail about some aspects of the work that's been done, if that would be all right, Councillor Crockett.
Yeah, absolutely. If you want to expand on some things with your officers.
Yeah, I didn't know if Stephen, Amy or Paul would like to touch on Talk Community particularly and the care home response. I know that there's been huge amounts of work in both of those aspects.
So before we go on to Stephen, etc., can I just say that two things that I noted, Rebecca. The one thing was you are looking at improving access to psychological services, and we're lucky to have Sue Harris here today, so she might like to say something about that new partnership, and also encouraging healthy behaviours. And I know your public health team are looking at ways to get more sustainable food places, reduce alcohol intake, cigarette smoking, and increase physical exercise and activity. And that physical activity strategy is coming up for review in the council very soon. So we will go to Mr. Stephen Vickers and see if he'd like to talk about Talk Community, or if he wants to hand it over to Amy Pitt.
Well, I can certainly, thanks, Councillor. I mean, certainly I'll just cover off some of the areas, because I think what the report does clearly is sets out a backdrop to, and particularly around the COVID response. And I think that's a really useful reflection for us, certainly when we start to benchmark what recovery looks like. I mean, I'm not mad on the word recovery personally. I think this is new opportunity, I think, in some ways for us all, and not a bad opportunity for us to sort of reset and rethink and just build build going forward. Recovery seems to have an end stage, I suppose, and then we get into, well, what does our development look like? And I'm not sure where one begins and one ends. So, but nevertheless, whatever we call it, it is an important benchmarking tool that we've seen here. And of course, our public may well want to go and explore some of this in more detail through the Understanding Herefordshire site, and I'd encourage them to do so, because you'll see a lot more of the detail that sits both within the report and wider detail that doesn't around Herefordshire's needs. Yes, absolutely, we'll talk about Talk Community, because increasingly this is it is certainly the council's response in terms of population health and the protection of the formal care services, and increasingly it's becoming the system's response, and that's very, very encouraging progress throughout this year. It's lovely to see system partners talking about talk community as much as we do inside the council. And I think full credit to all of those system partners who do that. We do, though, have a lot of work, as well as that Rebecca's already reflected upon. There's also a lot of work that is either developing or has already been developed, and we're ready to launch this. So just in terms of, for example, I'll give you a few examples, but Amy will be able to give you more detail should you wish. But, for example, around improving the overall mental and physical health and well-being of residents from an all ages perspective with a more diverse, increased level of support. I think that's one of the clearly linked to our county plan, and linked to that directly are things like the development of our talk community mental health and wellbeing training for community leaders, the debt and money management services that are being developed and in some places already in place around market towns. There's the talk community redesign from the front end of the adults and communities directorate, the council's front door. And of course, it's not just about adults, they're very much linking to our other colleagues within the council. Holidays Activity Fund, loads of work going on across the system with children's and with our Children and Families Directorate. Chris may want to say more about this, but it's great to see a real embracing of the talk community approach from across the council's other directorates, as well as across health partners, as I've said. Again, focusing on, let's not forget, again, work that's ongoing, but really important, I think, in terms of recovery or building a new Herefordshire post-COVID, the development of new models of accommodation for vulnerable people. This work and from all ages, including learning disability, older people and younger people. But there are several projects going on across children's and adults there. Developing also a community meal offer from Talk Community. Embracing the principles of no second night out from and housing first principles and the links to the Project Brave work there. Equally, developing an assistive technology approach to help people maximise living and independence. And that includes the delivery of a demonstration centre at Hillside. Again, really important in terms of our plans going forward. Supporting communities to improve their community resilience through the development of a network of community-led hubs throughout the county. We've now got 17 community-led hubs that have developed throughout this pandemic period. These are community hubs led by communities for communities. That's an incredible performance in respect of that work. And then also the integrated services hubs, which is an investment by the local authority in ways that it can offer environments that will help services to come together to tackle those inequalities, etc. And there's a ton more work going on. I think from this board's perspective, before I hand over to Amy, I think from this board's perspective, it is really important that we really build on this report that Rebecca's provided for us, because I think there's a real chance for us to do this work together. We need to be, of course, this board needs to reflect upon the work that's going on around the new integrated care system. That's absolutely critical. Around the new Herefordshire, the One Herefordshire partnership work. And of course, this board also needs to think what it looks like in the future, so that it can achieve, so it can deliver against its objectives, but also it can clearly secure its place in the system in order to improve the population health and of course protect our formal services. And I think from me, Councillor, I hope that covers it well enough for you, but I don't know if Amy wants to add anything. She is leading on at least some of those projects that I've mentioned.
Yeah, thank you, Stephen. I hope you haven't completely stolen all their thunder, but I will go to Amy in a second, and also Paul Smith, so that he can fill us in a bit more on PPE and care homes, etc. Is Ewan with us today or not? Because he was very involved with Project Brave, but if not, we'll leave that one for a minute. Before we hand over to you, Amy, Chris Baird, you've got your hand up.
I have, Chair, but if it makes more sense for Amy to talk, there's no standing on ceremony in that sense, but I would like to talk about children and families as well. But yeah, I'm happy either way, Chair.
Yeah, if we carry on with Amy, and then once Amy and Paul have had their 5 minutes of glory, then perhaps we will go to Sue Harris, and then Chris, you, if that's okay. Thank you. So Amy, fire away.
Thanks, Chair, and thanks, Stephen. Yeah, I think probably Stephen's covered it very well there in terms of the broad breadth of what Talk Community is, not just, as he quite rightly says, just the COVID response. But having said that, you know, the COVID response has been, and the flooding, let's not forget, as well, prior to that, has been absolutely fantastic in terms of our community is stepping up to provide that support and us working with them to deliver that. So, which is, you know, been absolutely phenomenal, and also gives us a really good platform to be able to move forward into the next stage of our relationship and partnership, working with our communities, which has been fantastic. I suppose the only other thing that Stephen didn't touch on is the work that we're working with an economic in place with Roger Allenby and the Talk business and Talk community business. So that's very much around working with businesses to support employees around health and wellbeing as well, and sort of the social value, and bringing in that side as well. So covering all sort of industries and areas as well with Talk Community and that approach. But yeah, it's been a great year for Talk Community, and I think, like I said, it just provides a really good platform for us to move forward and continue to evolve and develop the approach.
Thank you, Amy. Before you go ahead, Paul, Jane, you've got your hand up. Is there something you want to say now?
Sorry, no, I'm in the same boat as Chris. Bring me in.
Yep. Okay, thank you. Paul, do you want to say who you are and give us a rundown on your side?
Thank you, Chair. It's Paul Smith. I'm the Assistant Director of Commissioning for the Council. And thank you to the Acting Director of Public Health to give me a chance to contribute to this important report. Certainly as a council, our resilience and our approach to COVID has been admirable. For the past 12 months, the Public Health Department, the Public Health Commissioners and the Commissioning Department of the Council have worked hand in hand on the Council's response. And of course, that's been done in collaboration with health partners and also with Children and Young People Services. So there's been a whole council approach to this, which has been reflected in the DPH report that you've got before you today. Certainly from a care home perspective, and in particular around our response and resilience as a council and as a partnership and as a system to our care home colleagues. The council, Herefordshire as a county, has 85 care homes. And we've met with those care homes every single week throughout the whole of the pandemic and continue to do so, virtually, of course, because that's the world that we're now in. And we're getting around 75% attendance of those 85 care homes, and partners from WVT, partners from Taurus, partners from the Trust, all NHS partners are on those calls as well as the local authority. And of course, one of our most important parts of that response has been that working together in terms of the vaccine rollout recently has been absolutely phenomenal. The work with Taurus and WVT on the vaccine rollout towards care home staff and care home residents, I believe made us stand out as a county within the UK as a top performer. And of course, as a council, we invested almost £1.8 million in the last 12 months on personal protection equipment, which members of the public will have no doubt seen lots and lots of media discussions around. Herefordshire decided that we would provide PPE or personal protection equipment to care home staff, volunteers, internal staff, bus drivers, taxi drivers, anybody that would potentially come into contact with somebody with COVID or suspected COVID. We wanted to protect as a county. We felt that was part of our incredibly robust response. We've used local supply chains for almost all of that personal protection equipment, and we've established an incredibly tight control over PPE in the county, and as a result we've saved a number of lives, no doubt, and assisted our NHS colleagues and other partners. But most importantly, my reflections on the last 12 months in line with the DPH report is that we've grown as a system to the point where it now feels like whether you work for the NHS or the local authority or any particular directorate of the local authority, that we're in exactly the same team, and it feels like we work as a system. That to me is an incredibly good indicator of where we'll get to when the ICS, the integrated care system, becomes a reality in 2022. And I would like to thank the DPH, or the acting DPH, for her support as a department to the commissioning agenda of Herefordshire Council over the last 12 months. And I believe that we can build upon this incredible partnership that we've created over the last 12 months and really go forward as a system with a seamless proposal to people in the community, whether they have COVID or they're suspected of COVID, or whether we come out of the pandemic very positively and in 2022 we work as a system in the way that we've worked in the last 12 months. It will be an absolute pleasure to work with partners in the way that we have done. So I'd just like to acknowledge that. If there's any other points you want me to add, Councillor?
No, thank you, Paul. That's brilliant. It really does sum it up, the collaborative work that this partnership and this board does. So I thank you for that. So Sue, would you like to say a few words about the psychological side of things and the mental health?
Yes, thanks ever so much for giving me the opportunity. I say, for those who don't know me, Sue Harris, I'm Director of Strategy and Partnerships, Herefordshire and Worcestershire Health and Care Trust. And I suppose it's just worth noting at the point that the mental health services transferred from what was 2G previously to ourselves was actually the 1st of April last year. So thanks must go to the workforce for effectively going through a transfer in the middle of a pandemic with quite a lot of transformation in chain. So over the last 12 months, we've seen further investment come into mental health, into a number of pathways, both core services and specialised services. And actually that's been very welcome in terms of how we can work together to maximise the links with the voluntary sector, talk communities, as we've just heard from colleagues. So just to put some headlines in, we've had a major transformational programme called a Community Mental Health Transformation, which really is about making sure there's an earlier response wrapped around general practice. It was due to launch on the 1st of April, but actually for obvious reasons moved by 6 months. So it's still early days in terms of quite a cultural change in the way that services are provided in relation to mental health access and pathways. So working very much with our GP colleagues and the voluntary sector to basically find an easier access into earlier mental health support and to have a more holistic wraparound model very much bedded in with your community. We've also seen further investment go into improving access to psychological therapies. That's an annual investment, so we'll continue. And I think this is really important when we start to consider as a board the future demand that might be coming down the track in relation to mental health need, and that's across the ages. We've also been launched the Now We're Talking campaigns, are very much about where you can self-refer to get mental health support. That's both groups, one-to-one, and a range of materials. So board support to basically share and disseminate the access points for those services would be really appreciated. So that's the Now We're Talking campaign. If you put that in for Herefordshire, it will show that range of mental health support. And we're working with a range of providers, including the commercial sector, on making sure that we really do start to communicate the access to those services. And so we've been working with Herefordshire Racecourse, Herefordshire and Worcestershire Chamber of Commerce, and many, many more. We've actually got a Now We're Talking with Art campaign that will start in the next month or so. And again, it's just trying to find innovative hooks to get people talking about mental health, mental resilience, and what's available locally, and to maximise that community offer. We've also been fortunate enough to get some extra funding in for Recovery College. So that's really about making sure that people who have been very poorly with mental health needs actually have a mechanism back through recovery and into employment. So courses, materials. We've also wanted to widen that offer so it actually supports people who might not need statutory sector support, but actually do need more mental health support than actually is currently available. Really very much speaks to what you've heard from both Amy and Stephen about the Talk Communities programme, because it can be delivered through the hubs. It can also be scaling up what we've learned works in relation to online access. So it's a great opportunity to bring some of all of this work together, to see real investment coming into mental health pathways at a time we need it most. And again, to start to make sure that we maximise that collaboration, to take out duplication, and to make sure people don't feel like they're having to go around the houses to access early support for mental health. So yes, a lot happening in that arena, and I thank you very much for the opportunity to talk today. And can I say, for the warm welcome I've had personally in Herefordshire from a lot of you that I've never met physically, just because of the environment we've been in. So thank you very much.
Thank you, Sue. That's very kind words as well. We try to be friendly. One of the things that I was thinking about when you said about accessibility, I wonder if we can get some of these links added to the programme, Ben, and I'll ask you at the recommendation stage, I think, about which ones that I think we should include on the report. So Chris, would you like to come in now?
Thank you, Chair. And I'll build on what colleagues have said, including Sue, and it's great to hear, isn't it, the work around emotional well-being and mental health. But I'd also like to begin by paying tribute to all the colleagues who work in early years and education, because today is a significant day for the wider opening up of education, and hearing the reports that I have of the joy and the excitement that some pupils have been sharing as they see their their fellow children at school has just been fantastic. And I think that points to a way forward, doesn't it? And I suppose also recognises the emotional well-being benefits of socialisation and people being together, which is something that in the rest of society we're still not there yet. But the report from Becky really does highlight some of the key issues that children have faced over the past period, and their families as well. And there's been a huge amount of work that's gone on to support them virtually as well as face-to-face. So throughout the period, even during lockdowns, there have been children attending schools and attending nurseries for key workers and for vulnerable families, and that's been incredibly important and incredibly valued. And huge adjustments taking place almost on a weekly basis from services across partners under their Health and Wellbeing Board, really. So we need to pay tribute to that. I know from a children's sector perspective, we've met regularly to review how we're all delivering and how we can work together and what gaps we might be seeing. And the annual report points to some of the things that we might expect to be areas that we need to work together through the Talk Community approach with communities, with children and families themselves, and to enable them to make the most of the wider opening of society, if that's the right way of thinking about it. And I think Stephen's absolutely right not to characterise it as recovery. It's about living with, isn't it, in different circumstances. But as Paul Harris said, building on the tremendous collective endeavour and spirit and relationships that we've been built up through this adversity. And I think there's a lot we can do collectively on that through the Health and Wellbeing Board and also through our other partnerships. So the Children and Young People's Partnership, I think, we'll need to take stock of where we are as partners and that focus on children and families and see what we can do collectively. And that's also true through our safeguarding partnerships as well. And one of the areas which we'll be live to, but we need to be live to as partners, is what emerges as people come out, as it were, and start mixing and people start seeing each other. And, nationally there's talk of, eyes on children, and actually once children come into education and start setting out their experiences and being able to talk about their feelings, and there may be, and probably will be, a need for services and a need for that close work with children and families to meet their needs. So it's great to have this annual report, but we'll need to be live to what we observe and what takes place over the coming months, because I think things will emerge that we aren't fully aware of yet. And actually, in terms of child development, there's the national phrase of catch up, but actually that could go on for a number of years for some children and some families, and particularly given you know, the amount of time that's been missed, as Becky's rightly put. So some great things to build on here, but also we need to be live to what we see emerging once we have more direct contact with children and families, and what they feel they themselves want to organise and want to take part in and want to take advantage of.
Thank you, Chris. I think today is a really important day because this is going to be the start of the next phase, I think, of the refresh and recovery, and very importantly for children and their families. So could I go to, if I first go to Jane and then we go to Mike, because again, Taurus and the Wye Valley Trust have been pivotal in this this COVID response, and they may like to talk about the vaccine programme and the health recovery plans. Thanks, Jane.
I'll leave Mike to talk about the vaccine programme because he's very much been at the heart of that. I guess just a few reflections really I thought might be helpful. I think and absolutely reflect what others have said in terms of we now work together in a different way than the way that we've worked together in the past, and that has been, you know, 99.9% a very positive thing, and I don't think anybody wants to get let go of that. And what that's meant is that we've been able to make decisions together and make change together in a much more rapid way than we have in the past. The other reflection I would, before we get too Pollyanna about this, the other reflection I put into that is we've been in a time where we've had some pretty single purpose, and we haven't really had any financial problems to look at, and we're now going back into a more complex world of picking up all of the things that we haven't been doing so much over the last few years, and we are facing a more difficult financial position than we have in the past. So I think what we must do is hold on to all of those good ways of working. I think there is a bit of a holy grail here in terms of the Health and Wellbeing Board and a focus on that inequalities and prevention agenda that I think we have got more of a sign up than we've ever had before, and I'm certainly very keen that we keep that focus. And so, yeah, some of those transformation of pathways, you know, looking different ways that we're managing diabetes, different ways we're managing heart failure, much more link across primary and secondary care. But also we have got this a huge legacy now of people who are waiting for treatment, and so that, you know, that's going to hold back all sorts of other things around, whether it's economic recovery or people going back to work or other things, because we've got a massive waiting list of people who are waiting for treatment. So I think there's lots and lots and lots to hold on to that's been very positive, but I don't think we should almost fool ourselves that we can keep going in the way that the way we are, because we are moving back, I think, perhaps more into the real world, where we are going to have to make choices and agree on priorities. But I think we will do that in a different way in the future because of the enormous learning that we've all had out of the last year.
Thank you, Jane. I think that's really important that we do try to get back to the business as usual, as well as reflecting on what we've just been through and what we're continuing to go through. Dr. Hearn, would you like to add to that?
Of course. I think it's a year of collaboration, of course, as everyone said. And obviously this culminated particularly in the approach to the COVID vaccination, which was, I think, an impressive effort from all the whole system. You know, I'm talking here on behalf of Herefordshire General Practice, but actually it was far beyond that. When we look at the workforce and the support from communities, the volunteer workforce has been massive at each site. It continues, which is amazing. And then, of course, we've had the kind of approach with Wye Valley, the support from local authority, and staffing across the board, really, in terms of how we've delivered this. So, definitely, collaboration has been key. And I think, you know, at one point we were there thinking, should we, you know, can we lead we obviously, can we lead the country, but can we lead the world? And I think that was the kind of aspiration, which I think was really something we genuinely were trying to do. So I think we've done a pretty good job on it. So and I think lots of learning from how we think about this for future campaigns of working together, for all flu vaccination or any other things. And I think that just brings me just to perhaps reflect a little bit, as Jane was saying, about the kind of, what do we think about moving forward? It was interesting, Becky, in your report, I like, that slide and stuff, which from the BMJ about all the different impacts. And of course, a lot of the discussions I'm involved in are in one little bit of that graph, of that picture. And it just makes me think about how we need to continue, we need to improve the visibility and develop the relationships, more widely. One of the key things has really been, I think, that collaboration has been built on trust, and so the relationships that we've all developed over the year. And I think looking at those areas, I see housing and I see transport, and those absolutely understand the importance of those. But from in my world, those, we need to actually, how do we help each other to achieve the objectives that we need to moving forward? I think it's really important that we retain what we've done well, but actually build on that. And I think that's and that will need to expand. I think the role of this board is going to be crucial, I think, to hold the system, to make sure that we are getting the right priorities as we move forward, really. And I'm sure we'll pick that up at other meetings, but that for me would be really central to a success of building on that collaboration. Thanks.
Thank you, Dr. Hearn. It's really important, as you say, that the system is accountable, and that's what we're here to try and do. It's really difficult for me because there are so many people that I really want to thank, but I don't want to thank people and forget somebody. So, it's just a blanket thank you to everybody. As you probably all know, I used to work for Wye Valley Trust, and that place still does have a really heartfelt feeling there. So yeah, I go out to all my colleagues and say thank you. I would like to ask Ian Stead if he'd like to come in and talk, because he is part of the ICS and Transitions Board. So I just wondered what he'd like to add to this.
Thanks very much, Pauline. I mean, I'll add my thanks to everybody. It has been an amazing effort. We were incredibly impressed by the joint working in the very first lockdown, because there weren't any templates to follow. And we've said publicly in various discussions nationally that we were very impressed with the joint working in Herefordshire, and there were eyebrows raised because not many people were saying that in their areas, and it has been a fantastic effort, and hopefully we've been able to support it throughout. I think what we'd be interested to see when the time is right are the recommendations. However well we've done, there's always things that we can learn, so it'd be always useful to see what lessons have been learned in case of a further problem of a similar kind. It's always important to do that. And also just picking up Jane Ives' point that there is now this massive challenge of the recovery afterwards. It is huge. We don't in any way underestimate that. And, as Jane said, also big financial challenge, and that's only going to work with continued collaboration and slicker ways of working and new ways of working. And again, we strongly support that. But within that, there are challenges as well. We're very aware of the challenges of some things like digitally excluded people in new working ways, and we need to be very clear about that kind of situation. And also just to make sure that we can help out with communication of the new ways of working and the way that we're working our way into the backlog of work that has to be picked up, which, as I've said, is a huge challenge. And again, the link between talk community, hopefully being able to support local communities to get people into the digital systems and into the easier access to the different services that are going on is going to be crucial. And again, we strongly support that. But overall, we've just thought it's been a great effort in Herefordshire.
Thank you, Ian. That's brilliant. Thank you very much. I think every new venture is going to bring up new challenges, and I think we are really knocking them out of the park at the moment. So onward and upward. What I'd like to do now is ask if there's any more board members who've got any questions or comments, please, that they want to either add, or anybody else who hasn't had a say.
I don't know how to.
Okay, I think we've got Councillor Norman put her hand up, and then we'll come to you, Professor Thompson, if that's okay.
Thank you.
Okay.
Thank you, Chair. Yes, well, Chris has broadly sort of covered much of what's been happening in children and families and the issues that we know are coming along following COVID, or we're still with it, but as we move away from it. But I just wanted to add a couple of things. First of all, I think we do all appreciate what a challenge this has been for teachers and schools school staff have had a huge ask. And you know, we talk about multitasking. Well, this is really something that's been thrown at them, and they've had to develop and devise ways of dealing with online working, children in the classroom, keeping in touch with the more vulnerable children, and a multitude of things, reassuring parents, for example, who've really struggled, I think, but again, have also done an incredibly good job on the whole in working with schools and with their children. So there's a huge amount of learning and developing and working in incredibly difficult and unexpected ways for all those people. But I think, as somebody else said, this is not just about the challenges from COVID. It's about moving on and learning and progressing and doing things in different and better ways. And children, as adults, have found a lot of what's been happening hugely worrying. Anxiety develops, mental health has been affected, physical health has been affected, no doubt, and we have to find ways of addressing those. And I think there's great opportunities. You know, we've got lots we can do in finding funding to support schools developing green travel plans, for example. We literally know that if children get outside, get more exercise, get in the fresh air, are out where there are trees and all these other things, it's good for their health. And it will also undoubtedly help to reduce things like obesity and help to make them fitter and healthier in every possible way. So I think there's a lot we can do in encouraging and supporting schools in doing things like that, forest school working, all sorts of innovation that will be beneficial in every sense for the children, for their families, and perhaps for the environment as well. So I really look forward to seeing those sort of things going on. There's some positive stuff coming forward. A young people's survey that was delayed from last year will help us to get a better picture of where our children are and what they need and how they actually see this. Because I think actually children are remarkably resilient, but we need to know where they're coming from and work with them to improve things. For me, one of the most concerning things is a significant increase in poverty. We know that many families have lost jobs and incomes and, you know, are really struggling in some senses. I think, for example, in children's, we noticed that I think in October, over the previous year, we had something like 25% more children registered for free school meals. And that may well not have been the maximum number that would actually be in those circumstances and need them. So I do think there is a great deal that we can do and some very, very positive things that we can do to help. But we mustn't forget that some of the underlying issues and problems that we face are not just local, they are national. And we really need to work, you know, as a nation, if you like, to try and address some of those underlying inequalities, which are part of the problems and the issues that we're facing. But I do feel very confident that schools having and our children and families directorate and the way everyone has risen to the occasion, we've all learned so much. We've learned different ways of working, and I feel really confident that these challenges will actually, you know, bring out interesting and innovative new ways of taking us forward. Thank you.
Thank you, Councillor Norman. We'll go to Professor Thompson next, and then we'll go to Rebecca.
Thank you. I'm so sorry, Councillor. I can't find my hand.
It's fine.
Here. I'm going to sound a bit like Pollyanna, as Jane Ives describes. I just like to say thank you to Becky, really, because I think the way you laid out your presentation has enabled the most rich conversation, a really genuinely a very informative conversation across from all sorts of people contributing. I suppose now, to build on, everyone's talking about the building on, and I think that's right. It's about, so how are we going to translate that part of the learning into the action plan for this board and what it wants to do, taking it forward? But I did want to reflect, I think I'm really pleased Dr. Tate has been on leave for me to be able to have the benefit of hearing that richness of conversation. Thank you.
Thank you very much. But no doubt Dr. Tate will be informed later on about what's been going on today. Rebecca, you wanted to come back in and possibly answer some of those queries and concerns?
Yeah, thank you. I think I was just going to reflect some of that. I mean, thank you ever so much, everybody. I mean, there's been so much going on, hasn't there? And it's been great to everyone to reflect those different aspects. I think just picking up on what a couple of people said, it has been over the last year, we've had a real that real single purpose, haven't we? And that real energy and drive towards one goal almost. And I think the challenge in terms of the going forward is how, yeah, exactly as Jane was saying, kind of how we pull that together to have that single vision against other aspects and to move out of that and to not, you know, I'm sure we wouldn't ever you know, slip back into old ways, if that's I don't mean that in a rude way, but you know, it is about taking that opportunity, isn't it? And my view would absolutely be about in those inequalities and what we can do across that whole system in all our different, you know, all of those different tools that we've got. You know, even our COVID response is not to date, you know, before vaccine, we didn't have a single response. It was about every little thing having a small contribution. And for most of our challenges, we'll find that's the same. We'll find that it is every little part which has a big, you know, which together help us address, whether that is, you know, childhood obesity, whether that's, you know, cardiovascular disease, whether that's isolation, all of them, it's every little bit that the whole system can do together. So I think it was just that it's a challenge because we'll end up with our different parts of the system having our different recovery plans and our very detailed action plans. And I think our role here would be about that kind of overview and ensuring that we have got that breadth across the system, that we're keeping our eyes focused, in my mind, would be on the inequality aspect of it.
Thank you. Right, are there any others in attendance who've got any questions or comments before you come back in, Stephen? Can't see any other hands up anywhere. So, Stephen, would you like to follow on?
Well, it's only really to pick up on Professor Thompson's comments, because the question that was asked there, and we shouldn't be too surprised that it was so insightful, because that's what I think Professor Thompson sometimes brings to these conversations. But it is absolutely the right question about what's next and how and what's next, particularly what's next for this board. And the answer to that, at least to some degree, is that we have got work to do. And I think that's an honest reflection. There is obviously the response to what's been discussed here, what's in Rebecca's report and those challenges. And there is then the challenge about how we work as a system together in terms of focusing on around these really important issues. And most of all, how we make a difference and hold ourselves to account as a system. And of course, that all has to be set in the context, as I mentioned earlier, of the ICS work and the counterbalance to that, plus the local One Herefordshire partnership work. So just for your assurance, at least from that perspective, we know that the work needs doing. The Transitions Board, the One Herefordshire Partnership Board, has already agreed that it will work at things from their end. We're closely connected to the work of David Mahaffey and the ICS, and that's an ongoing dialogue. And I think the next step for us as a board is also to get back in the room, having listened to that end of the business, at least, if you like, and work out what we're going to do. But what we shouldn't forget here is what we reset the bar for this board last year, and COVID kind of got in the way to some degree of us writing on that blank canvas as to what this all could look like. But now is the time, isn't it? As COVID comes to an end, or at least, we move away from what we've been doing over the last year, we've now got a blank canvas to start from. And that's an opportunity, I think, one that we should really all embrace. So, I'll be working with Ben and Councillor Crockett and other board members to sort of set up this board's programme of work, but importantly, connecting it to that really important end of the business, because we've got to be effective. I think we're all clear about that. But a great question, and thank you for that.
Thank you, Stephen. Wise words as always. Opportunities and a big programme. That's what we've got to deal with now. Does anybody else have any comments or questions? Oh, Ian, you've got another comment or question?
Yeah, it was just to support Stephen and his comments then, that I think there's an opportunity now to have a fresh look at the Health and Wellbeing Board and see how it fits and how it can help to take the new agenda forward. The circumstances are now quite different, and a little bit of work to get it right can make a big difference to how it can support the agenda that we've all just been talking about.
Thank you very much, Ian. Okay, does anybody else have anything to add to this at the moment? No? Okay. There are a few recommendations that I'd like to see if we agree on. Shall I just fire ahead, Ben? Is that okay? Or have you picked any up?
We've got a recommendation report at page 13 anyway, about which colleagues will have seen. The other thing I was wondering if you wanted to add was about putting appropriate links to services and resources on the Health and Wellbeing Board web pages. Clearly, we've talked about understanding Herefordshire today, also the talk community support and the access to mental health services. So I think we probably look at refreshing our profile on the website just to make that a bit easier to follow through. So if colleagues have got links they'd like incorporated, that'd be helpful for them to forward to me. But I'll obviously let you identify any further recommendations that you want to record. Thank you.
Thank you. The links that I've already noted are Understanding Herefordshire, which is what you've just mentioned, Talk Community. I think it's really important that we get the county plan thread through this report. Now we're talking campaign, yes, definitely, and possibly a link to the JSNA as well. If anybody else has any other additions that we perhaps need to link to, that would be really helpful. And if you do think of those, later on today or tonight or whatever, please forward them to us and we can add those in. Any other comments or questions before we go to what it looks like, the recommendation? So if I can ask that we put the recommendation up on the screen, please. Thank you, Ben. So the recommendation that the Health and Wellbeing Board notes and considers the findings of the report and provides leadership in addressing inequalities created by or exacerbated by the COVID-19 pandemic through recognition of these challenges, communicating the key messages of the report to their constituent members, and identifying further actions that can be taken by constituent organisations and across the system. And B, appropriate links to services and resources be added to the Health and Wellbeing Board web pages. Does the board wish to add any further recommendations at this time? No? Okay, so can I please have a proposer and a seconder for the recommendation?
Yes, happy to propose.
Thank you, Mr. Vickers. Anybody to second, please? We had Dr. Hearn, he was up there with his hand, so that's brilliant. Thank you, Mike. Okay, so I'll now ask board members to vote. Please can non-voting attendees be moved to the breakout room and the number of voting members be confirmed. Thank you.
Yeah, we still have 13 voting members and they may vote now.
Thank you very much. Board members, please cast your vote for either for, against or abstain. Trying to do that at the same time as saying that please submit your result following the option. So hopefully we've got everybody has voted and submitted.
Just waiting for one, Chair.
Probably me, but hopefully it's not.
We are still waiting for the one, Chair, but the results are unanimous. I've got 12 votes in favour for, and the last 13th vote has come in now. So those have been approved unanimously, Chair.
Thank you very much. Please can non-voted attendees now be brought back into the room. Okay, thank you all for your patience. That recommendation has been approved unanimously. The next Health and Wellbeing Board meeting is planned for Monday, the 7th of June, 2021. I'd like to thank everybody for attending on this beautiful afternoon and for your contributions today. And I would like to close the board meeting to the public. Thank you.